Chapter 18, Therapeutic Agents for the Endocrine System. The terms and definitions we will go through as we progress through this lecture video. In the beginning of the chapter, we have the common drugs for conditions of the endocrine system. This is a really great chart because it has the pronunciation of the generic names, which are the hard ones to say. We will talk more about these drugs throughout this chapter. This is a really great chart to kind of indicate the most common drugs for the endocrine system. The endocrine system produces and secretes hormones from various glands. The Greek word hormone means that which sets in motion. This is what hormones do. They activate specific target cells and organs to elicit a response. The body produces different hormone types in different glands. Endocrinologists are physicians who specialize in the study of glands and hormones. This figure 18.1 illustrates the principal endocrine glands. 3 glands are located in the head: the pituitary gland, the hypothalamus, and the pineal gland. You can see them all here. Excuse me. At the base of the neck, the thyroid gland produces 3 hormones that affect metabolism: thyroxine, T4, triiodithyrone, T3, and calcitonin. The parathyroid glands, positioned slightly behind and above the thyroid gland, secrete a hormone called parathyroid hormone, PTH, which helps maintain adequate calcium levels. Located lower in the chest is the thymus, which secretes hormones that play an important role in the immune system. The 2 adrenal glands are in the abdominal area, 1 gland positioned above each kidney. The adrenal glands secrete specific hormones, epinephrine and norepinephrine, and they're linked to the stress responses of the body. The largest endocrine gland is the pancreas, and it's responsible for producing and secreting hormones from groupings of cells. These islets of Langerhans contain alpha cells that produce glucagon and beta cells that produce insulin. The gonads produce sex hormones. In women, the ovaries secrete hormones such as estrogen and progesterone, and in men, hormone that is secreted is testosterone from the testes. Glands have 2 mechanisms of action: endocrine or exocrine. Hormones produced by endocrine glands either enter the bloodstream to reach their target site or act at target sites near the site of hormone release. Hormones produced by exocrine glands are sent to the target organ or tissue via a tube or duct. The endocrine system hormones are classified as proteins, steroids, and amines. Proteins include insulin, growth hormone, and calcitonin. Steroids include cortisol and aldosterone from the adrenal cortex, estrogen and progesterone from the ovaries, and testosterone from the testes. The hormones thyroxine, epinephrine, and norepinephrine are examples of amines. A feedback system maintains hormone levels in a normal range. Homeostasis is disrupted if glands secrete too many or too few hormones. Rather, a delicate balance must be maintained to produce the correct response. Accordingly, many hormones are regulated by sensitive feedback loops that control the hormone amount produced by any given gland. And table 18.1 has select endocrine glands, their hormones, and their functions. So here are the hormones and target tissues, and then the function. So oxytocin is something that a lot of you might know about. It is used to stimulate uterine contractions during birth and milk ejection into the mammary ducts. Receptor sites for hormones are located inside and outside of the cells. Protein hormones fit into receptor sites outside cells, whereas steroid hormones enter into and attach to receptor sites inside the cell. Both mechanisms cause a reaction. The following three signaling pathways influence the endocrine system and the production of hormones. Number one, negative feedback is the primary regulatory mechanism for maintaining homeostasis. In negative feedback, a stimulus results in actions that reduce the stimulus. Here's just a figure kind of providing an example of a negative feedback loop. Two, positive feedback may also occur. However, in positive feedback, a stimulus results in actions that further increase the stimulus. For example, during labor, specific hormones are released that promote continued release of more hormones until a result is achieved. Contractions result in the birth of a baby. Number three, the third response is via the nervous system. Stressful situations can alter the production and secretion of specific hormones that, when released, prepare the body for the situation. For example, if a person is in an emergency, the body requires more energy. Therefore, hormones such as epinephrine are released, giving the body an extra boost of energy. The hypothalamus is located in the brain below the thalamus. It is a small organ that links the nervous system to the endocrine system. It stimulates the pituitary gland by neuronal impulses and directly or indirectly regulates most endocrine activity. The pituitary gland is analogous to the control tower of the endocrine system. Two hormones, oxytocin and antidiuretic hormone, are stored in the posterior portion of the pituitary gland. Oxytocin stimulates uterine contractions and cervical dilation during birth and lactation. And ADH, also known as vasopressin, affects the kidneys, cardiovascular system, and the central nervous system. This entire pituitary gland system is regulated via negative feedback control from the nervous system, specifically the hypothalamus, and from the levels of other hormones. The pineal gland produces and secretes melatonin, which is a hormone that facilitates sleep onset and influences biological rhythms and the onset of sexual maturity. The gland is affected by retinal responses to light, with exposure to light suppressing melatonin secretion. And melatonin is available as an OTC product to help with insomnia. The thyroid gland is located at the base of the neck. It is responsible for producing and secreting those three hormones that we already talked about, T4, T3, and calcitonin. Iodine is necessary in the thyroid gland to synthesize T4 and T3. Each hormone is named to indicate the number of iodine atoms that it has in its structure. T4 and T3 are important in regulating the rate of metabolisms of proteins, fats, and sugars throughout the body. Therefore, they play an important role in the growth and homeostasis of the body. Calcitonin plays an active role in the regulation of calcium levels. Calcium is the major mineral found in bones. Calcium is also important for the proper functioning of muscle contractions, nerve impulses, and blood clotting. Three different hormones, calcitonin, vitamin D, and PTH, maintain a constant level. The function of calcitonin specifically is to inhibit the removal of calcium from the bone. Parathyroid glands are located behind the thyroid gland. and they have two sets of secreting glands. These glands are the primary regulators of calcium levels in the blood through PTH release. PTH increases calcium levels by stimulating the calcium release from the bones and by stimulating calcium reabsorption from the kidneys. PTH also activates vitamin D to increase the calcium absorbed from the intestine. The parathyroid glands are regulated by the calcium concentration in the blood and bodily fluids. And when calcium levels are higher than normal in the blood, it inhibits parathyroid glands and slows PTH release. When calcium levels in the blood fall, however, more PTH is released. In this way, the negative feedback mechanism regulates PTH. The adrenal glands are located directly on top of each of the kidneys. Each adrenal gland consists of a central portion known as the adrenal medulla and an outer region called the adrenal cortex. The adrenal glands are important in helping the body cope with stress. The adrenal medulla synthesizes and secretes the catecholamines, norepinephrine, and epinephrine. These hormones are stored in the adrenal medulla until activated by the sympathetic nervous system. The adrenal gland cortex produces three types of hormones: glucocorticoids, mineralocorticoids, and sex hormones like androgens or estrogens. The pancreas is the largest endocrine system organ. It carries out both endocrine and exocrine functions. The pancreatic exocrine function is to secrete digestive enzymes into the small intestine. The pancreatic endocrine function maintains energy homeostasis throughout the body by regulating blood glucose and sugar levels. The gland primarily accomplishes this by secreting both glucagon and insulin from cells in the islets of Langerhans. So here is 18.9, just a figure kind of showing you the pancreas right by the intestine. Does it show the islets of Langerhans here? No. And 18.10 is just the regulation of blood glucose sugar level by insulin and glucagon. And you can see that homeostasis is in the middle of that. The testes produce and secrete sperm. The testes are found in the scrotum. Sperm production begins before the age of puberty and decreases with age, although most men produce sperm throughout their lifetime. The production of testosterone in the testes is responsible for the growth of adjacent organs such as the prostate gland, seminal vessels, and vas deferens. Testosterone is also responsible for secondary sex characteristics such as change in voice as a boy enters puberty and increased muscle development. Many endocrine system conditions are due to too much or too little production of a hormone by a gland of the endocrine system. Because hormones are critical to functions of other tissues and organs, diseases of the endocrine system can have a variety of effects throughout the body. So table 18.2 has a summary of select conditions associated with the endocrine system, and it gives the cause. So for syndrome of inappropriate antidiuretic hormone secretion, the cause is an increase in antidiuretic hormone ADH, which causes an increase in total body water and hyponatremia. And you can read through all of those. It's kind of interesting. Syndromes of inappropriate antidiuretic hormone secretion is a disease of the posterior pituitary gland characterized by inappropriately high levels of secretion of ADH, vasopressin. So a medication for that could be declomycin, and common dosage is here, auxiliary labels there. Diabetes insipidus is a rare disorder caused by ADH deficiency. Causes of this condition include brain tumors or infections of the meninges, which is meningitis, or brain and hemorrhage in or around the pituitary gland. Kidneys that do not respond normally to the hormone cause the same type of condition and symptoms. This condition is known as nephrogenic diabetes insipidus. Hypopituitarism involves a range of dysfunctions from absence of select pituitary hormones to complete hormone dysfunction. Gigantism and acromegaly are two rare progressive conditions that involve increased GH levels. Tumors can cause pituitary gland hyperfunction. In children, this is called gigantism. The bones elongate, resulting in heights as high as almost 9 feet. If the condition arises after puberty, it is called acromegaly. And a medication that helps treat that is sandostatin. It is a subcutaneous injection. In contrast, dwarfism comes from diminished GH stimulation or production. These patients have short stature and decreased organ size regular to a normal adult. There are multiple types and causes of dwarfism, but the primary treatment usually involves Humatrope, a once daily subcutaneous injection that acts like GH in the body. Often patients continue with this therapy even after puberty to maintain a steady GH amount. Thyrotoxicosis results from increased thyroid hormones. Hyperthyroidism is a specific form of this secondary to thyroid gland hormone secretion. Common diseases that cause hyperthyroidism are Graves' disease and toxic multinodular goiter. Graves' disease is the most common hyperthyroid cause. It is an autoimmune disorder, and the body manufactures antibodies to TSH receptors, leading to an increase in the production of T4 and T3. A goiter makes the neck appear larger. A non-malignant tumor of nodules in or on the thyroid gland from excess thyroid hormone production form the root cause. They're painless. They range in a size from barely discernible to grapefruit size. Prescribers usually do not treat small goiters as they may resolve on their own, but if it continues to grow, medications are an option, and surgery only usually happens with medication treatment failure. The medication, which we abbreviate as PTU, you can see why, is a medication indicated for hypothyroidism. There's also the medication Tapazole, which the generic is methimazole, and that is given for hyperthyroidism as well. When the thyroid gland does not secrete sufficient levels of T3 and T4, a condition called hypothyroidism develops. So hyper means overactive thyroid, and hypo means underactive. So hyper is high, hypo is low. That's how I always remember it. It can be caused by congenital defects, defective thyroid hormone production, and thyroid tissue loss after surgical or radioactive treatment of hyperthyroidism. Hypothyroidism due to a congenital deficiency or thyroid dysgenesis affects the growth and nervous system development of the child's body. If discovered late, this condition will stunt the child's growth and may produce mental retardation. Once diagnosed, lifelong thyroid medication therapy is initiated, and any previous mental damage is irreversible. A lack of dietary iodine can cause a thyroid hormone production deficiency because we need iodine to make T3 and T4. Hypothyroidism caused by iodine deficiency is uncommon in developed nations because salt contains added iodine. Therefore, patients with hypothyroidism rarely need iodine supplementation. Thyroid gland inflammation, also known as thyroiditis, so anything with itis means inflammation, and that is an autoimmune condition. Hypothyroidism is common in women over 35, are most often affected. Symptoms can include sensitivity to cold, brittle fingernails, constipation, unexplained weight gain, and other issues. It results in an overall energy decrease and a lack of mental alertness. It can also be associated with myxedema. Some symptoms are the skin appears puffy and waxy. They can have dramatic mental changes with a severe condition such as myxedema coma. So the medication Armour Thyroid, which is just a desiccated thyroid, a combined T4 and T3 product, is indicated for hypothyroidism and for goiters. The medications Synthroid, Levothyroid, Levoxyl, Tyrosint, and Unithroid are all brand names for the medication levothyroxine, which is a T4 supplement. This is a very common medication. There's a lot of strengths. They're all color-coded. And this is actually a medication that a lot of patients will require DAW, dispense as written, brand name on their prescription, because it is known that the fillers in the generic product can interact with some patients. So some have to take brand only. So for a medication that's as old as Synthroid, you're going to probably have a lot of brand name strengths of this on hand because we do use it quite a bit. Then we have Cytomel, which is T3, and that's also sometimes used as an off-label augment antidepressant in patients who have not had adequate response to antidepressant therapy. We also have Liotrix, which is another combined T4 and T3 product. Hyperparathyroidism stems from increased PTH secretion in the bloodstream and can come from one or more of the 4 parathyroid glands, generally the result of a benign tumor. Another related condition is secondary hyperparathyroidism, in which parathyroid glands compensate for chronic hypocalcemia, which is low blood calcium due to renal failure or poor calcium absorption. These two hyperparathyroidism forms both display increased calcium levels. The increased PTH levels promote calcium release from bones into the bloodstream. This leads to bone weakening and an increased fracture incidence. So medications, we have Rocatrol, which is calcitrol, pretty common in the retail setting, and then we also have a intravenous form. The medication Hectorol is also prescribed for this, available as oral and intravenous. Zemplar, available as oral and intravenous. Sensispar, which is just available as an oral tablet. Hypoparathyroidism is the parathyroid gland malfunctioning. It is often due to damage to the parathyroid glands during thyroid surgery. The result is hypocalcemia, which in turn reduces vitamin D levels. Each adrenal gland has 2 parts, a cortex and medulla. The adrenal cortex disorders range from steroid overproduction to underproduction. The 3 steroid types produced include mineralocorticoids, glucocorticoids, and sex steroids. A decrease in steroid secretion affects sodium, potassium, and chloride levels and can alter carbohydrate metabolism or cause sexual problems. Cushing's disease is a condition of excessive ACTH secretion from the anterior pituitary gland. Hyperaldosteronism is an issue of excessive aldosterone secretion by the adrenal glands. Aldosterone promotes the excretion of potassium and the retention of sodium and water. This is due to an adrenal cortex abnormality, whereas secondary hyperaldosteronism is caused by a stimulus outside the adrenal glands. Hypertension and hypokalemia hypertension is high blood pressure, hypokalemia is low blood potassium, are the primary hallmarks. Addison's disease, which is associated with inadequate corticosteroid and mineralocorticoid synthesis and elevated serum ACTH, is a rare hormonal disorder caused by cortisol deficiency. For Addison's disease, we have the medication fludrocortisone. That's a mineralocorticoid. A glucocorticoid, we have Cortef, which is hydrocortisone, but it's the tablet. It's an oral formulation, not the cream. Medrol, methylprednisone, is also prescribed orally. Solumedrol is available as an intramuscular and an intravenous injection. Prednisolone is also used for Addison's disease. This is oral. Be a liquid or a chewable, or it's like maybe a ODT too as well now. The medication prednisone, which probably most of you or some of you at least know somebody on it or have been on it yourself once when you're sick before. It is very common. It's usually a medication that starts at a high dose and works its way down. And this is prescribed for Addison's disease as well, along with a lot of other things. Most adrenal medulla conditions result from tumor growth. The main tumor types that affect the adrenal medulla are pheochromocytomas that continually secretes catecholamines, which can result in hypertension. The pancreas is responsible for insulin and glucagon production and release. It's important in the transportation of glucose into the cell. The cell then uses it for energy or stores it as glycogen. Insulin also stimulates protein synthesis and releases fatty acids from adipose tissue. The condition associated with hyperglycemia or a blood glucose increase is known as diabetes mellitus. We abbreviate that as DM, a chronic endocrine disease associated with hyperglycemia. The two most common types are type 1 and type 2 diabetes. Type 1 is caused by the destruction or defect in the beta cells of the pancreas. Because people with type 1 cannot produce insulin, they must use exogenous insulin. The classic hyperglycemia symptoms that can lead to this diagnosis include frequent urination, excessive thirst, excessive appetite, and glucose loss via urination can cause dehydration, weight loss, fatigue, and extreme hunger. Most diabetics have type 2 diabetes. Type 1 is an absolute deficiency of insulin, where type 2 is due to insulin resistance or a decreased ability of tissues to respond to insulin. Insulin resistance increases with obesity, therefore most type 2 diabetes patients are obese. This commonly affects adults, however, obesity in children has resulted in more of them with type 2 diabetes. Because of the type 2 diabetes insulin resistance, the pancreatic beta cells have to work harder to produce insulin to compensate for insulin resistance and keep blood sugars normal. This is a metabolic disease with a number of comorbidities. And here's conditions. We kind of already went over that. Strong family history is one of them, older than 45. History of gestational diabetes, meaning diabetes when you're pregnant. So if younger and earlier in life you have children and you get gestational diabetes, you're more at risk for getting type 2 diabetes later on in life. Lack of physical activity, obesity, hypertension, hyperlipidemia, those all are conditions associated with that. Gestational diabetes occurs in women during pregnancy, and blood glucose levels usually return to normal after childbirth. GDM is associated only with pregnancy. Weight gain and an increase in the estrogen concentrations and placental hormones, which antagonize insulin, are the two precipitating factors. The effects may last only through the pregnancy period, although the condition must be treated through diet and possibly medications. And we have a chart of currently available insulin products for the market. Rapid acting insulin. Here is our chart. The onset of action, meaning when does the medication start working? Within 5 to 15 minutes. The duration of action is how long it's going to last in the body. So about 4 to 6 hours. Then we have short acting insulin products. The onset of action is about a half hour to an hour, and they stay in the system for about 6 to 10 hours. MPH insulin, which is intermediate acting, has an onset of action in about 1 to 2 hours and lasts in the body from anywhere from 10 to 16. Long acting insulin has, insulin detamere, which is Levemir, has a 3 to 4 hour onset of action and lasts for about 14 to 24 hours. Lantus, insulin glargine, has an onset of action at about 2 to 4 hours, and it should last in the body 24 hours. And here's just a list of pre-mixed insulin products. Then we have non-insulin medication for the treatment of diabetes. So we have quite a few. We have insulin sensitizers. We have biguanides. Metformin is really popular, first-line treatment for type 2 diabetes. You can read through all of these. A lot of these are common medications prescribed. And because type 2 diabetes patients require multiple medications, they have now made combination products between two drugs like metformin and glipizide and metformin and glyburide, stuff like that, because they provide an easier path for daily compliance. And here is a list of combination oral treatments for the treatment of diabetes. So you can see here we have metformin glyburide, metformin glipizide, metformin algoliptin. So we have quite a few. A lot of them are newer. Two recently approved products to treat diabetes include insulin glargine Toujeo and inhaled insulin, which is Afrezza. Toujeo includes a long-acting insulin that contains the same active ingredient as Lantus. However, it is 3 times more concentrated as Lantus and is more effective at controlling blood sugar during sleep. Normally, only small dosage adjustments are necessary when converting from Lantus to Toujeo treatment. Another novel insulin therapy product is the inhaled Afrezza. The insulin is the same as that in Humulin, but it is inhaled rather than injected. The FDA approved it in 2014 as an alternative for diabetic patients who do not want to inject insulin. However, it has gained little popularity in the US market. Patients must demonstrate their ability to breathe in a full dose through regular lung testing. Smokers and those with COPD are generally not considered for this dosage form. Even with good lung function, the patient must use an injectable long-acting insulin in combination with Afrezza. Patients hoping to avoid daily injections will still inject once daily. In the United States, many people continue to struggle with obesity. The CDC reports that more than 1/3 of U.S. adults, or 78 million people, are obese. This can increase the major risk for chronic health problems like high blood pressure, heart disease, stroke, diabetes, and much more. We have some medications for obesity management. We have Xenical, Belviq. These are both oral. We have Qsymia, oral. And health professionals ask diabetics to monitor their blood glucose levels with a glucometer by taking a drop of blood using a small needle called the lancet. Although the finger is the most common location for blood sampling, some meters allow blood to be taken from the forearm, thigh, or fleshy part of the hands. This is known as alternative site testing. The blood is placed on a test strip that is inserted into the glucometer. They digitally display the current blood glucose level. A wide range of meters are available. There's some with large size, some that have talking capabilities, and now there's like tons more since the book has been written. There is like the wearable ones that you can just scan under your arm. There are more technology-based ones like that you hook up to your computer that you can track your information, stuff like that. And newer electronic devices attached to patients' skin connect to mobile devices and provide less invasive ways of monitoring blood glucose.